Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Eliza Andrews, who is the owner of Inspirit Therapy Associates based out of Pere, Wisconsin. As a physical therapist and pelvic health clinical specialist, Eliza considers herself a puzzle solver for her patients, and she loves helping people find the root cause of their symptoms. She discovered early in her career that a whole body approach was the key to quicker recovery, so her practice combines traditional treatments with lifestyle management, nutrition, and emotional support. In 2009, Eliza became one of the first PTs in the nation to earn the Women's Health Clinical Specialist designation, and she has been a leader in the pelvic health therapy world ever since. When Eliza is not helping patients, you can find her working on a DIY remodeling project, reading, or spending time with her husband, kids, or grandkids. In our 4 episodes together, her experience of over 30 years shines through as we discuss numerous topics related to pelvic health therapy, including an overview on what pelvic health therapy looks like, symptoms specifically related to kids like bedwetting and constipation, how pelvic health therapy can help treat reproductive challenges such as endometriosis or irregular or painful periods, and how pelvic health therapy can be a game changer for women in the childbearing years. Get ready to learn a ton? Here we go with today's conversation. Hey everybody, welcome back. We're back with episode 2 with Eliza here. Welcome.
Hi.
We are going to be talking about kids in today's episode, which may be actually a surprising topic that you wouldn't be expecting to be talking about with a pelvic health therapist, but we're excited that you are able to help with this population as well. So pelvic health therapists are known to help with bladder and bowel dysfunction, but that sounds a little scientific. So can you tell us exactly what we're talking about with bladder and bowel dysfunction?
For kids?
Yeah.
Sure. It's kind of interesting. We obviously, our kids are in diapers when they're little. We know that. That's for ease. That's for us. That's not for them. That's for us. But kids can suffer from the same things that adults can suffer from. They can definitely suffer with constipation. They can suffer with difficulty controlling an urge when they have to go to the bathroom. They can also struggle with bedwetting or not feeling how that function is, especially when they're sleeping. Kiddos that they're playing and all of a sudden it just happens and they aren't aware of it. It can look like all of those things. It can also look like kids who don't have bowel movements often enough, like regularly, and that can start as soon as infancy for some of them.
Okay. So some of that kind of seems like, like constipation could be related to lifestyle. It could be related to maybe some physical changes that maybe you could help with some manual therapy. But also some of those pieces seem like it's more of wiring between the brain and the body working.
Mm-hmm.
So
Absolutely.
Let's talk about constipation first. How do you specifically help with that?
So the first thing is one of the things that we do when it depends on the age. If I brought an infant that isn't going to the bathroom, a lot of times that's just that the nervous system hasn't quite figured out those connections. So there's some exercises usually that the parent is doing with the child. Most people are familiar with the bicycling legs and all those kinds of things. There are some manual therapies where we teach how to do what I call the magic tummy rub. And but it's specific. It's not just rubbing the tummy. There's some, points you want to make sure you hit and certain pressures you want to make sure you use. So we do a lot of education. As our kids get older, we want to make sure that they're balancing. We talk about fluid. We do talk about fiber. We talk about diet. We talk about how active they are. Kids these days, a lot of them are less active. They're on their devices. They're on sedentary activity. So are we getting them outside enough? Are we getting them running and jumping? And even when they are outside and active, are they climbing trees and doing dynamic things? Or are they, doing, I'm going to pick on people who do one sport and one sport only. That's it's not great.
Yeah.
Because not dynamic enough maybe. And then the other thing is from a mind standpoint, kids have some really interesting ideas about bathrooming. There are kids who are afraid to go if they're not in their own bathroom. There are kids who can't go at school because of anxiety. There are kids who can't go in other public places. School might be safe, but other public places might not be. There are kids who there's a trauma that associated with it. We do a lot of shaming when we do bathroom training in this country. Oh, did you poop your pants? Oh my goodness, how could you do? Because we as adults are so put out by it. And we don't realize that we create this shaming attitude so unhealthy for kids.
Yeah.
And then they get more and more and more withdrawn about it, and they struggle. Anxiety, kids that have anxiety, a lot of times we will see that manifest in their toileting. So we need to change the way we do toilet training in this country a lot. And sometimes it is physical. Kiddos who have hypermobility syndrome really struggle because their parts aren't elastic enough to help move the stool through the GI tract. So we look at all of that.
Okay, so what would a session look like? So if I think that my kiddo may have some constipation and I was like, oh, I heard that a pelvic health therapist could help with this. What would that actually look like if I brought my kiddo in to see you?
Probably depends a little bit on the age. So, with an infant, there's not much prepping. We bring them in, we put them on the table. Mom or dad or whomever brought them with is right there. We do all the education as we're doing the evaluation. Toddlers, they come in, they're all shy. And they're afraid to be at the doctor's office. So we play. We have toys, we have books, we get out the big bouncy balls. Sitting on a big bouncy ball and bouncing your toddler will really help them poop, by the way.
Well, there you go.
There's an easy one everybody can do. So we'll play and then eventually, we'll work our way into some exercises. When we get the older kids, like the 4s and the 5s and the 6s, again, more play, but now a little more directed exercise. We make all the exercises fun. We make them all games. We encourage whichever adult brought them to be part of the game because they're going to do these games at home.
Right.
I had a little 6-year-old who she just turned 6. She's super cute. On the way home from the appointment, she's telling her mom, she's like, Mom, I learned about my pooping muscles today. And did you know you have them too? And of course, Mom was in the appointment, but Mom. So then like a couple of days later, the 5-year-old is telling her younger brother, who's 4, you have pooping muscles and you have to learn how to use them. And I love that.
So cute.
Yeah. So they, if we make it really normal, I think for kiddos, we just have to help them know that this is something that is normal and we're just, we're going to fix it. It's easy.
Yeah, and I love how you talk about intertwining the education piece in it, because like what you were saying originally of just how society has a lot of pressure on kids to learn this quickly and get it over with. Right. And that you're kind of helping to educate the family in that nutrition side and things like that too. So constipation, do you see a lot of repeat patients that are kid age? Or is this kind of like they go through constipation, you help to educate them, and then based on the education, they can kind of prevent this from happening again in the future?
This is such an important one that I think of all the education that I try to do with parents, sticks. The bathroom stuff sticks because it makes it actually makes parents' lives way better because what we strive, especially with the kiddos that are like 4, 5, 6, 7, to get them we do a lot of toilet scheduling. That makes life better for parents. So parents do stick with it pretty good. Yeah, I don't get a lot of bounce backs. Mm-mm.
Okay. Well, that's really good to know because I feel like you just hear about constipation in kids a lot more nowadays. And I don't know if it's more prevalent or if we're just talking about it more.
Sometimes it has to do with trauma too. Like
Mm-hmm.
you talk, and you help them through that too. Or
We do.
Yeah.
Yeah. And we'll do, depending, like a lot of times we'll do what we call daily recaps, different titles depending on the age of the child I'm talking to. But I've got a 5-year-old who's journaling. Every day at the end of the day, she draws a picture about her day. That helps her talk to her mommy about what happened in her day so that if there was something that really upset her and makes her have a tummy ache, and then she can't poop because her tummy hurts and it's all anxiety.
Yeah.
But so we taught a 5-year-old how to do her own journaling. She loves it.
I hope it sticks because that's powerful.
Well, and her mom's like, makes me want to do it. I'm like, go for it, Mom.
Yeah, do it together. Oh, how sweet.
So what other types of challenges that kids are experiencing do you help with outside of constipation? We talked a little bit about bedwetting.
Bedwetting. Yeah,
right?
That's a big one. And, people ask me at what age should that go away? There's no direct answer. I've got some teenagers that are still struggling with that. That does come down to, some of that comes down to trauma often. But it also can come down to like some people just sleep really, really hard and they aren't waking up. So we work on some different strategies there. Kids who have hypermobility syndrome need to be treated consistently from young on because they have a lot of risks for orthopedic issues, especially if they're going to be active in sports. And there's certain sports that some of them maybe shouldn't participate in. So that needs to be screened for. And then they need to work with a therapist who understands hypermobility. You mentioned briefly before that, why are some of these things showing up or why are we seeing more of these things in kids? It's environmental a lot. It's our food a lot. Like our food is just crap.
Just be honest, yeah.
It is. But it's also just our lifestyle changes. We're so busy. We're so go, 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 go. And all the pressures that you feel, your kid feels those.
Oh, yeah.
Your kid feels every pressure that you feel. And they're concerned about you and whatever you have, it's magnified in them because they're taking on the same amount, but they're in a littler body.
And they don't understand it either.
Mm-mm. No,
Right.
They don't. And so I also think, not to be political, but we really hurt our children with the way we handled the pandemic 4 years ago. We are going to have a lot of kids who are going to have some really deep traumatic responses from that. We said the kids heard things like, well, don't hug grandma. You get her sick. She could da-da-da or what. there was.
Yeah, depending on the age, it'll be very interesting to see that outcome in 15, 20 years.
Yeah, there were some. So I think we're going to see more stuff, and which is unfortunate.
So when a family is coming in to see you, you're obviously doing a physical assessment. Mm-hmm. You're also asking questions to kind of do a little bit of a mental assessment as well. Mm-hmm. If you're not finding anything physical, do you have like other professionals that you work closely with that you're helping to refer them to?
We do. I'm really blessed in our clinic because we have occupational therapy in our clinic that has a psych basis. So we actually have some programs that we're adding in our clinic that are specific for trauma response and trauma management. We're going to be doing heart math starting in January. Carrie Van Lannen, doctor of occupational therapy, is joining us, and she's a trauma specialist. So that's going to be really nice for the kiddos and the adults too. And then we do have mental health providers, quite a few. There's a few life coaching, like Betsy White with Life Coach for Kids. I have to say it right, and other people. But I have a whole list of resources. I know which physicians are a little helpful if we think that physician interaction is required. I do a lot of educating of physicians, like helping them know what the resources are too.
Yeah, and what to look for, and what's important.
Yeah. Are there any other common things that you treat within kids?
We'll do all the developmental delay stuff, torticollis, feeding problems, tongue and lip tie. So for the infants, we're doing those things. Like I had a kiddo come in the other day and with mom, and I was watching the kiddo play, and I was just like, I knew their age, and I was watching what they were doing and not doing, and I'm like, okay, I'd like to make a birth to 3 referral.
Oh, okay.
There was some, and so, sometimes kids sometimes just need a little encouragement, a little bit of help. So yeah, those kinds of things. And if it's something that's really intense, then we will refer out to pediatric specialists.
Okay. I think that this is just so interesting because, it's physical symptoms like constipation. I would think of physical therapy potentially for that because you're going to be doing some maybe manual therapy and, like you said, some education on like, here's some massage techniques you can do for the tummy and like, here's some additional exercises that you can help to get things moving. But even just, I'm actually a little bit surprised in how much we've talked about the mental health side of things and how you can help with that. So I think that's why these conversations are so important, is because so many parents are feeling lost and like they've lost hope and they don't know who to turn to. And I love knowing that you're a wellness advocate, meaning that even though you specialize in physical therapy, you have connections that you can help them get the help that they need, which is exactly why we started the Motherhood Alliance.
Right.
Because years ago, even just as prenatal postpartum personal trainers for us, there was so often times that our clients needed help outside of our expertise, and we wanted to be able to gently guide them to the next person that they needed if we weren't the right fit. And I love that you're doing that even within your own clinic. Why don't you tell us a little bit more about your clinic? Because you have multiple providers in there, like you said, and you have a big vision for the future. So let's talk just briefly about that as well.
So Inspirit Therapy Associates, we have PT and OT on the therapy side, and we have a wide variety of providers. We have everybody in our building has some kind of, or on our side has some kind of specialty, but we anchor the Inspirit Wellness Center. So I had a vision for a long time of bringing as many providers as I could together into one space. So I have massage therapists, reflexologists, lifestyle coaches, fitness professionals, Reiki, cranial sacral therapy, infrared sauna. We're at it. I don't know. We have 17 providers over there, so I probably missed somebody. But we're happy to work with anybody. So if just because someone isn't in our building doesn't mean we won't work with them. And I've cleaned a long list of people. I have a drawer. My staff laughs because I have a drawer full of brochures and cards and things. So if somebody's like, I need this person, I'm like, oh, I have a card, or oh, I have a whatever. I'm still old, so I still use paper. I know you can Google it, but I have to have it on paper. And so yeah, our biggest thing is really creating those teams, adding like Betsy's example, Betsy White, life coach for kids. She is absolutely just amazing. She's amazing. And I had a kiddo that came to me and he was bedwetter, and I knew it was a trauma response. And it was a bad situation at home. And every time he went to bed, he was scared. And about the second session in, I figured that out. And he was 7. And I sent the family, and she ended up doing parenting coaching because it was a parenting thing. It was the way he was being parented. That they were young parents. They needed some help, that kind of thing. So it's not that we can do it all, but we have to know who can do what these kids need.
Right. It's just really a blessing for a parent to go to one person whether they can help them with a lot of things. Like, you go to them for a headache, and all of a sudden you learn that you can, it's a hip problem, a pelvic problem, but then also you can help them with mental health or whatever. So, and then having access to all these other professionals, especially under the same roof.
Well,
that's great.
Yeah. And we are looking, we're constantly expanding, constantly bringing in more people. We're always looking for more resources. And our goal is eventually to, if I'm going to say this out loud, keep growing it.
It's a lot. Well, you have a beautiful building, but then you have a pretty large campus. Honestly, you have a lot of space there. So I know
we just doubled the size of it.
You did. Oh my goodness. I guess we got to go see it again.
Yes, we do. Road trip. Road trip for us anyway. We're on the west side of Appleton. But for those of you who did not hear in the first episode, Eliza is located in Pere. And so if you're interested in learning more about her clinic, what is the website that they can find more information at?
www.inspiritpt.com. And there's a link that's our PT website. But from there, there's a link to the wellness website. Right on the top on the banner, it says, go to our wellness center. And that website is currently under construction because we've had to change. We've had so many additions that it's being added to daily.
Wow.
So
Awesome. Well, thank you
That's
for
great.
being a wealth of knowledge and just a really safe place for families to come to and get the help that they need.
I love working with the kiddos. I just do. It's so much fun. And it's great to see them come in not feeling well and leave like giving high fives and smiling and happy. It makes my whole staff happy.
Oh, absolutely.
It's the best.
Yeah.
Awesome. Thanks, Elisa.
Yeah.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.